Introduction: A Medicine for Male Intimacy, written by Dr. Rangan Chatterjee. Many people have heard of a little blue pill, often called by a brand name, but the medical name is Sildenafil. It is a prescription medicine that has helped many adult men who experience difficulties with physical intimacy. This issue is medically known as erectile dysfunction. A man finds it hard to get or maintain firmness for intimacy, often due to reduced blood flow in the area. This guide explains what sildenafil does, how it works, who it may help, who should avoid it, and the possible side effects. We will also cover heart-related cautions, medication interactions, counterfeits, and why this medicine must be kept away from children. To understand how sildenafil helps, first the basics. During arousal, signals travel from the brain to local nerves. Those signals relax vessel muscles and increase blood flow. Spongy tissues fill, creating firmness. An enzyme called PDE5 reverses this by pushing blood back out. For some, PDE5 activity or poor flow makes firmness difficult. Sildenafil blocks PDE5, helping vessels stay relaxed longer. It supports improved flow during stimulation, typically for 4 or 5 hours. It usually starts in 30 to 60 minutes. A high-fat meal can delay it. It treats symptoms of flow but not the root causes. This medicine is intended for adult men diagnosed with ED. A proper diagnosis is the first and most critical step. Your clinician will review overall health and cardiovascular status. They will ask about high or low blood pressure, chest pain, rhythm issues, heart attack or stroke. Other conditions include liver or kidney disease and certain eye disorders. Provide a complete list of medicines, vitamins, and supplements. Some with well-controlled BP may still be candidates at a lower dose. If ED relates to blood flow and your health permits, a prescription may be appropriate. Dosing depends on age, health status, and other medications. Good candidates follow instructions and keep communication open. Some people must absolutely avoid sildenafil due to severe risks. The most critical, those taking nitrates for chest pain. Nitrates plus sildenafil can cause a dangerous sudden BP drop. This may lead to severe dizziness, fainting, heart attack, or stroke. Guidelines: If you take any nitrate, do not use sildenafil. Your care team will emphasize this without exception. Avoid if your doctor says no moderate activity due to heart risk. Also avoid after recent heart attack, stroke, or serious rhythm issues. Avoid with uncontrolled high BP, very low BP, severe liver or end-stage kidney disease. Only a thorough medical screening can identify these contraindications. Sildenafil affects blood vessels, so the main risks are cardiovascular. It relaxes smooth muscle, widens vessels, and lowers BP slightly. In healthy adults, this dip is usually minor and tolerated, but with narrowed heart arteries, even a small drop can trigger chest pain or worse. Your clinician will assess coronary disease, heart failure, and valves. Testing may be advised to gauge your heart's capacity. The pill does not attack the heart. Its BP effect can unmask issues. Also consider the exertion of intimacy itself on heart rate and BP. Be transparent about chest pain, shortness of breath, and exercise tolerance. Stay open with your clinician so they can keep you safe. Like all medicines, sildenafil can cause side effects. For most, these are mild and wear off in a few hours: headache, warmth, redness of the face, and a stuffy nose, indigestion and brief dizziness from a BP dip, temporary vision changes, slight blue tinge, light sensitivity, or blur. Back pain or muscle aches, usually not dangerous. Tell your clinician if they persist. Seek urgent care for sudden loss of vision or hearing. If an erection lasts over 4 hours, go to the ER immediately. Major risks come from interactions with other substances. Alpha blockers with sildenafil can drop BP. Doctors may use low doses carefully. Some antifungals and antibiotics slow breakdown, raising levels and side effects. Even grapefruit juice can increase drug levels. Share a complete list so your team can check interactions. Using it without ED or guidance is risky and may hide real problems. Unregulated online pills can be fake, wrong dose, or contaminated. Only take medicine prescribed to you and dispensed by a licensed pharmacy. Never use a friend's pill or buy from unverified sources. Simple rule: prescribed only from a trusted source. This is a powerful prescription for adults and must never be given to a child. Children's bodies, hormones, and circulation are still developing. It is not a matter of a smaller dose. It is unsafe for children. A single adult-strength pill can cause a dangerous BP fall in a child. This can lead to fainting, shock, and reduced blood flow to vital organs. Accidental ingestions have resulted in serious emergencies. Store all medicines locked and out of sight and reach. Do not leave pills on counters, nightstands, or in easy-open organizers. If a child may have swallowed a pill, treat it as an emergency. Do not wait for symptoms. Call emergency services or poison control and go to the nearest ER. Be ready to share the medicine name and estimated amount. Absolute rule: sildenafil and children must never mix. You now understand how it works, benefits and significant risks. The safe path begins and ends with your doctor. Avoid self-diagnosing, a friend's pills, or internet pills. Have an open, honest conversation with a qualified professional. Prepare to discuss experiences, health, lifestyle, and habits. Bring a complete list of medications, supplements, and vitamins. Your clinician will review risks and advise if sildenafil is appropriate. If prescribed, follow dosing exactly. Do not take extra or more often. If it seems not to work, do not take another pill. Schedule a follow-up. Your clinician can adjust dose, investigate causes, or suggest alternatives. Good healthcare is collaborative. Book an appointment and bring your full medical and medication history.